Good evening, friends. We'll start with today's session and we're going to learn one more new remedy from Allen's keynotes, that is the borax. It is a biborate of sodium. Before going to the remedy, we'll discuss certain aspects of the two cases which are very important and which explains the remedy very clearly. There was an old man, 65 years, who was brought to me. It was around 2000, in the year of 2000. He was having oral thrush with a canker sores, cracks at them, and there were aphthous ulcers on the tongue, the inside of cheeks, even inside of the lips, and they are having the yellowish base over there. One more thing which was there, that whenever he used to eat or whenever he used to eat the salty things, sour things, it used to bleed. That was one important thing. He said that, Doctor, I was absolutely normal 1 year before. Nothing was there. I have never suffered from any disorder. But I started getting the toothache, for which I have consulted the dentist. He took an X-ray and he said that there is a caries at the base. We have to go for doing the treatment of it, root canal. And after root canal, we have to fill that gap and you have to use the cap. I have done all things whatever he has told. Nearly three settings were done for the root canal, and then he took the exact measurements, and then he 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 has brought that specific silver colored cap over there. He filled that and fixed the cap. And after putting that cap on that teeth, thereafter I have started getting this iphthous ulcer. I told him that this is happening. He said, no, there is no question. It is not related with it. It is related to your food. He has given me B complex tablets,
నిన్నటిది ఉంది అయిపోయింది
multivitamin, many things he has given, but it was not of use, any use. Even I have seen, I have shown it to one of the surgeon also. He has said, yes, nothing so much problematic. He has prescribed again same things. He has given me little bit antifungal along with that. I have used that, but that also was not of any use. It is continuous. In fact, little bit settled and again recurred, and it is so painful that I cannot eat the little bit pungent thing, not at all. It is so painful. It is troublesome for me. So that was a typical picture. The dental cap. After that, this has started the bleeding aphthous ulcers, generally on the tongue as well as inner side of lips. Then there were canker sores at the cracks at the mouth, and it was too painful with yellowish base. That is very important thing. So because of which I have given him directly a borax, because borax is a very important remedy when you think about this oral thrush, specifically in old man. If it is associated with too much salivation, dribbling saliva, then you might think of Merck salt. But here there is no excessive salivation. So, and second important thing, that it it has started after putting a cap over the teeth. So that was very important. So I have started him in borax 200, repeated for nearly about 8 days, and asked him to meet me after 10 days. After 10 days, when he met, he first thanked me, Doctor, after a long time, it has been very clear, nearly 90% of the problem is solved. I'm able to swallow everything, and basically pain has vanished. And really, it was looking very good, healthy over there inside mouth. I have continued him for another week, Borax 200, and then asked him to meet me after a month, and he was good. So it is a wonderful remedy in aphthous ulcer. If it is associated with gastritis, hyperchlorhydria, with burning in stomach, with alcoholism, then you might think of acid sulfur. So that is one more remedy which you can think in oral thrust. These are three important remedies for the aphthous ulcers. And one more is Natrum muriaticum. As Murphy has rightly said, Natrum mur is one more important remedy generally overlooked for the oral thrush or aphthous ulcers. So this is one case, and second case was interesting. She was just a newly married woman, 25 years. In fact, a BHMS student. My student, she was in our college, and she came for the treatment of hair problem. And she said, sir, there is a lot of problem. My hairs, they are getting splits. There is splitting of hairs at the end. And second important thing, I'm not able to comb. I cannot, because they are so entangled with each other. That is the problem with me. Second important thing, this has started nearly about 2 years back, and it is increasing. I have gone to the skin specialist. They have given me certain shampoos and all those things, but it never worked. Even oils, they have given me multivitamin, vitamin E, all those things, but it was not working. Second important thing, I'm having these acne specifically. Her face was red. She was fair colored, very fair colored, but face was flushed, red. That was very important thing which was present. And third important entity which she has mentioned, that she had every time in between periods, she had a very severe profuse leukorrhea. So I asked, how is the leukorrhea? What is the quality? She explained that it is like white of an egg, that is albuminous, it is starchy, sticky, that type of discharge is there, but it happens between the periods every time. And that is also troubling me a lot. And these were the things. So I searched in the repertory regarding all those things. And one important thing, I will share the screen. There was one very nice rubric which is there. Yes, just see that in complete repertory, you will have this. Yes, eruptions, acne, women in young plethora, single remedy borax for 3 marks. Very important. It is 3 marks it has been given. So I have given her a borax 30 repeated for a period of nearly about 5 to 6 days. And I asked her to meet me after a 15 days. Basically, after starting the medicine, she has improved. Her acne disappeared. Second important thing, her leukorrhea settled. Hair problem was as it is. So I have increased the potency to 200 and later 1 m. And when it was reached to 1 m, hair problem settled very fast. It has recovered completely. The entanglement that has settled, then the splitting that has reduced a lot. And hairs were looking quite good. That was, she was saying that now I am able to comb my hair. That is the basic thing. So these are very important two cases where uh, these are not uncommon things, but which are part and parcel of our cosmetic practice, which used to happen in our practice. So this is one important remedy one should not forget over there. So after listening these two cases, let us go with the Allen's notes and let us see about what he says about the borax. The first important sentence, very important, is the dread of downward motion in nearly all complaints, and that is the characteristic of borax. It is given in bold, and it carries a big mark. Great anxiety from downward motion when laying the child down on couch or in the crib, cries and clings to the nurse. When rocking, dancing, swinging, going downstairs or rapidly downhill, horseback riding. See, this is very important feature. This is what which is characteristically present in the borax, dread of downward vision, and that is very, very marked. Even in elders also, this dread of downward motions are there. They never likes to sit on those wheels where it comes very fast down in one downward direction. They avoid going over there. They fears, and that is the characteristic of borax personalities. So sanicula is also one of the remedy where you get the dread of downward motion. Children awake suddenly, screaming and grasping the sides of cradle without apparent cause. And that is again the same thing. Yes, this remedy is very well proved, good remedy to be. If you are going to understand this remedy, my suggestion, go through the Vitulka's Matramedica Viva. You are going to learn a lot about this remedy. Even the mentals you can get. He has explained the mental state very nicely. The children of the borax, how borax children are there. He has very nicely explained about those things. Children awake suddenly. They all of a sudden they are in sleep and they awake suddenly, screaming and grasping the cradle without apparent cause, like apis, like sina, like stramonium. But here the cause is fear of falling. That is very typical of those borax. Excessively nervous. Here, excessively nervous means on the tip of their nerves, very sensitive, very restless, easily frightened by slightest noise. They are very easily frightened. Even slightest noise affects them. Or an unusual sharp sound, they get excessively nervous, frightened. A cough, a sneeze, a cry, lighting a match, such a sharp sound because of which they get frightened. Very sensitive. When it penetrates the body, it penetrates the bone, it is asaram or it is theridion. These are the two remedies we know. One more is caladium. He has mentioned over there. They are very sensitive to the noise, but frightened by the noise is very typical with the borax. See the hairs. Hairs become frowsy. Frowsy means dirty looking. They are untidy. That is frowsy. The word frowsy means dirty, untidy. Hair becomes frowsy and tangled. Splits sticks together at the tips. If these bunches are cut off, they form again and cannot be combed smooth. This is very typical. If you cut them again, they will form the similar thing. So you by cutting, you cannot clear the patient. This is only thing you have to do. Give right remedy, and if it works internally, then it will become normal. Cannot become smooth like fluoric acid, like lycopodium, like soranum, like tuberculinum. But borax is very specific for the for those features. Fluoric acid, it is a very good remedy for hair fall, specifically baldness, alopecia areata, alopecia totalis. Fluoric acid plays very vital role. Lycopodium is also one of the important remedy for early hair loss, early hair graying of hairs. Lycopodium is there. Soranum, the hair becomes gray in spots. That is the characteristic of soranum with lot of dandruff over there. Eyelashes. Eyelashes, they are loaded with dirty gummy exudation. That is very typical. The eyelashes, there is a lot of exudate happens to be there on the eyelashes. Agglutinated in the morning, turn inwards. This is a good remedy for entropion. They turns inwards and inflame the eye. So conjunctivitis because of entropion. That is very typical with borax. Turn inward and inflame the eye, especially at the outer canthus. Especially at the outer canthus, there is a angular conjunctivitis you can get. Tendency to the wild hairs. Hairs are wild. Wild means they are in every direction. They are not normal. That is wild hairs. Nostrils, they are crusty. They are crushed like sticta. This remedy is one more remedy for crust inside nose. Inflamed. Tip of the nose shining red. This is very important. Red noses of the young woman, characteristic thing of the borax. The nose steeps, it becomes absolutely red. That is typical of this borax. Stoppage of right nostril, or first right and then left, with the constant blowing of nose. So there is continuous, they tries to remove the discharge, blowing of the nose, like ammonium carb, like laccaninum, like magmur. This is one more remedy for the obstruction of the nose. Ammonium carb, it is very specifically at night, midnight, 3 o'clock, ammonium carb is there. Alternate nostril, that is laccaninum, magmur, the discharge is sticky, mucoid. Aphthy, very important is aphthous ulcers. Aphthous ulcers in the mouth, on the tongue, inside of the cheek, easily bleeding when eating or touch, prevents the child from nursing. So it is very difficult for child to nurse, because this is children's oral thrush. This remedy is the wonderful remedy. They cannot suck because of that. That is very typical with the infants. Prevents the child from nursing, with hot mouth, dryness and thirst, like arsenic. Cracked and bleeding tongue. Tongue is cracked, it is bleeding, like arum triphyllum. But arum triphyllum, it is associated with severe acrid corroding nasal discharge, with severe irritation in arum. And the discharges, they are corroding very strong over there in arum triphyllum. Apathy with salivation, especially during dentition, borax is the remedy. Aphthous sore mouth is worse from touch. What is it? It is worse from touch. Eating salty or sour foods, eating the salty food, eating the sour food, always aggravates the aphthous ulcers. Aphthous ulcers of old people. See, underline this. This is very common with the old people, and this is very important remedy for that. Then often from the plate of the teeth. See, very important indication. Alumen is one more remedy. Alumina is different. Alumina is aluminum oxide. Alumen is pure aluminium. Alumen is one of the remedy for such types of aphthous ulcer caused because of plate of teeth. Child has frequent urination and screams before the urine passes. So before passing the urine, there is a child screams like lycopodium. There is a printing mistake in the book. It has been written lysine. It is not lysine. It is lycopodium. So change that. It is lycopodium, sanicula, and sarsaparilla. These are the remedies where the screaming before passing the urine, which has been specifically mentioned over there. Leukorrhea. Important future. Leukorrhea is profuse. Leukorrhea is albuminous. It is starchy, with sensation as if warm water were flowing down. That is very typical. They explains, the patient explains, doctor, it is very hot, as if some hot water is running. That is very typical with the borax. For leukorrhea for 2 weeks between the catamenia. Between the catamenia means between the menses, in between two menses. The Bovista is another remedy which we are going to learn in tomorrow's session. Bovista and Conayam. These are two important remedies. Leukorrhea in between the periods. Skin borax, very important remedy for skin problem. Skin is unhealthy. Slightest injury suppurates, like calendula, like heparocell, like Merck soil, like silicea. This is one more remedy where slightest injury suppurates. It is very good remedy for acne. So pustular acne, sometimes it might be, one must think about the borax if rest of the features are associated. Relationship, the borax follows calcarea, sorinum, sanicula, and sulfur. So borax is well followed by calcarea, well follows the calcarea, sorinum, sanicula, and sulfur, and is well followed by arsenic, bryonia, lycopodium, phosphorus, and silica. Most important modality which is mentioned or hint, incompatible, should not be used before or after acetic acid, that is vinegar, or wine. One remedy just which we have worked, that is the before this remedy, which is that where the incompatible with the alcohol, which is the remedy. incompatible with wine. Benzoic acid, which we have discussed before that. It is also, this is specifically the wine, borax and benzoic acid. Aggravation. Aggravation is from downward motion, from sudden slight noises, very important. Smoking aggravates, which may bring on diarrhea. Damp, cold weather aggravates, and aggravation before urinating. So all the features very important modalities. And last, amelioration, general amelioration. There was a question, sir, sensitive to noise means what reaction is their patient? How he explains it. Basically, sensitive to noise means they are intolerant. They cannot tolerate it. It is like Naxwamika, where their sensitivity is like that. If you are just changing the pages of the book and noise comes, or if you are changing the pages of newspaper and a sound comes, and that they cannot tolerate. They explain, I cannot tolerate such types of sounds. Or if someone is talking loudly, they cannot tolerate that. They immediately reacts. They immediately reacts with certain specific sentences. So this is sensitivity to the noise. And basically, if there is some internal problem which gets aggravated to that because of noise, that is very typical. They are more sensitive to the noise. So that is sensitivity. Amelioration by pressure, amelioration by holding painful side with the hand. See, amelioration by pressure, like it is, this modality is very close to the bryony. And that's why they presses that thing, and because of hard pressure, they feels better. It is close to the bryonia regarding this modality. So borax is a very important remedy in our practice. Two rubrics you must write it down on your book. These are very important, which I have collected again from complete repertory. There is sterility, leucorrhea from. Sterility, leucorrhea from. Borax 3 marks remedy. Sterility is from leucorrhea. And one more rubric is there in complete repertory in female genitalia chapter. Sterility, menses profuse from. Borax is given for 3 marks. These are two important rubrics one should not miss. So this is a wonderful remedy in our practice, which one must learn and use in practice. Very commonly, we can get all those entities in our practice. So we'll complete this remedy today, and tomorrow we'll continue with the Bovista, another important remedy in practice as well as from the syllabus. So that's all for today. Yes, there was one question what he asked me at the start.
Yes, sir.
Yeah.
Actually, I was supposed to ask what that yesterday's picture we have seen that mother was catching hold of that hand.
Huh.
So that concomitant, is it necessary to prescribe the thing, or without that concomitant we can prescribe?
No, that's the thing with this is very important. Holding the hands continuously. If the mother tells you, yes, she is not leaving me, she is keeping my hand fixed with me. If it is there, then it has a significance. You have directly a rubric holding desire for, and specifically with parents, with mother, with the attendants, that has been there. And that thing, if it is specifically persistent, if it is persistent, then it has meaning. It is not just for time being. What she has said it is for continuously for 3 days. She was not leaving me, holding my hand. That has its importance.
Okay, sir. Yeah. Thank you, sir.
Anupama, what you have asked, I could not get.
No, sir. I was saying it belongs to row 3 in the periodic table, sir.
Yes.
Borax.
Yes.
That's it, sir. Thank you, sir.
Okay. Is there any query?
So actually, when we go according to mind method, na, so Borax, what all rubrics you said, of course, this we were not aware of, and we go towards the simillimum too much into mind method, sir. So your knowledge adds it otherwise, sir, in physical way also. We
Yes.
can catch it up very fast.
My suggestion
you.
to all of you is that yes, mind method is very good, no doubt about it. But always make a habit of going through the physicals along with that. That will give you
Yes,
the
sir. Physical
total.
is of course our foundation, sir, because we have been
Mm.
doing it since so many years.
Yeah.
Physical and predictive, whatever little bit knowledge we have, that is the foundation.
Yes.
Without that, we can't proceed ahead, sir.
Yes.
Thank you, sir.
There was one question. In appendicitis patient better with heart pressure, can we give borax in appendicitis? What type of pain it is there? That is, it is the general modality of borax, but borax doesn't carry directly action on appendix very strongly. Borax, bryonia has very specific action on appendix. So we have to understand where exactly it works, and that you can utilize that. So that is important. The sphere of action is very important to be understood. Dr. Indranil, he has asked fear of downward motion. Kindly elaborate from mind method approach. Anupama, can you?
So that's what we specify when the person says like I get scared to go into the buildings, heighted buildings, or even in crowd. So that person feels scared to look down. Or in mind method, we take it when the person has reached certain stage of life. From
Correct.
there, he has the fear of downfall, sir. Downfall means I'm not able to stay in this particular this period of my life, and I'm going downwards. Means we
Correct.
take it the fall of the person. That's it.
Yes, that is one thing. Second important thing, I have seen that it has been applied by one of our friend in the specifically in delivery case, that head was not coming out. It
Yes,
is
sir.
with the
Yes,
pressure,
sir.
it was coming and again receding back, and it was going again and again. And he has utilized this with the metaphorical meaning that fear of downward motion, and borax was given, and child is delivered. That was another aspect which I have seen utilized by one of my friends.
Maybe they may be having some phobia, like stability, while seeing the ground from the upper side. They may be having some stability feeling or some fear, whether they will fall or they will get
Yes,
accelerated like this.
yes, yes, yes.
Maybe.
It's a fear from coming down, from the position, from the stairs, everywhere. This is both at the mental level, at the physical level, at both levels this is present. And
So when we prescribe borax, is boron the same, or boron is again different element from borax, sir? Boron,
generally they
because
are very close to each other, nothing so much. It is by borate directly. It is a what you molecule prepared from it. So same remedy we used to get. It is not separate remedy we used to get in the market.
yes, sir. Thank you, sir.
If leukorates from puberty, which potency? It depends upon situation. It is not fixed. It might be 30, it might be 200, whatever it may be. It depends upon susceptibility of the patient. Okay. Yes, Dr. Indranil, anything you have to ask?
Yes, Dr. Prasad. Actually, Dr. Shankaran had attended some few webinars. Like sir's version, patient's version was, suppose a patient of osteoarthritis comes to us. And he says, sir, हे पुढं जाऊन हे खूप वाढेल का काय असं वाटतं आणि म्हातारपणी हे त्रास देईल. So he used to narrate that fear of downward motion, looking at the age. So, is it applicable for all cases, or it is only for
No,
the
no,
purpose of mind?
no,
Mind म्हणजे.
no. When you try to make more and more metaphorical meaning, you can find it out any meaning. But
Yeah,
then
yeah.
what is the use of proving then? Proving
Huh.
patient has not explained it in that manner. So my suggestion that you should not make more metaphorical meanings of them. It is always
Okay.
better to take it as it is, that will be more useful. To show your intelligence, to show your talent, it is better to show such types of metaphorical meaning. But what happens? The people runs behind those interesting metaphorical meanings instead of understanding the original rubric, original symptom. And many
Okay.
times they fails in practice because of this. So my suggestion is always that you should go with the regular method, regular meaning, understanding them. And once you get mastered about it, you are sure that this is borax. Then you can show it with the help of metaphorical meaning. That is the interesting fact which you can, and this is the fact which happens to be there with stalwarts. But many times people runs behind that, and that creates the
Yeah.
problem.
Okay. Okay. Thank you. Thank you. Yeah.
The file, I used to repeat this. This is 30, it requires repetition. It is not 1 or 2 doses. At least for 5 days, 6 days, you can repeat tedious. So today we have discussed many things. A good. This is what actually communication should be like that. Tomorrow we'll discuss the next remedy, Bovista. I think it is Bovista, and we'll meet tomorrow at the same time. Thank you. Good night.